and really just get a sense of it's a lot of information. As we were going through the slides, we've covered a lot this summer. Health and Human Services, as you all can imagine, have been really impacted by the pandemic and have adapted and responded in great ways. And so we're gonna recap a little bit about that, kind of put out there what some of the remaining policy asks are in some of those spaces. And then we'll turn it over to our guests to just talk through how they've been experiencing things as it relates to the pandemic, responding to their constituents, and also offering some tips to engage in policy advocacy virtually, because I think we're gonna all need to adapt to that in the coming months. So I am Tara Britton. I'm the Director of Public Policy with the Center for Community Solutions. Very briefly, we're a nonprofit, nonpartisan think tank that aims to improve health, social, and economic conditions through research, policy analysis, communications, and advocacy. I am going to turn it over to my colleague, Kelsey Bergfeld with Advocates for Ohio's Future. She's gonna kick off sort of our recap portion of our presentation, and then she'll turn it back over to me. Thanks, everyone.
Great, thank you so much, Tara, and good afternoon and happy Friday to all. Like Tara said, my name is Kelsey Bergfeld. I'm the Coalition Manager for Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of a really wide range of health and human services, policy, advocacy, and provider organizations from both the state and local level. Again, we really work together to make sure that our most vulnerable citizens have the resources and services they need to live great lives and make sure that they have a really healthy and prosperous communities. So we are going to very quickly take a quick look at where we've been through this webinar series and take a quick look back the past few months at what we've covered and some of the key takeaways from the past few months. So once again, we want to thank you very quickly for tuning in over these past few months. We've really enjoyed putting these webinars together. We know when we think back to April, things and policies were changing so quickly, needs were so great across communities. We really wanted to make sure that we provided a great source of information as policies were changing so quickly at both the state and national level. So we've put on 13 webinars since April. We've had over 30 presenters, both Advocates for Ohio's Future members and new friends join us over these past few weeks. And we've had over 2,500 unique attendees join us. So we are very happy to join and welcome you to our network. And hopefully we provided some great information when you needed it during these past few months. Just a quick look back, we did first cover back in the first week of April, the first federal policy response. We went over the Families First Act, as well as the CARES Act as it was passing through Congress. This is where we first saw some of those big federal waivers that exempted some requirements and eligibility verifications and waivers for different programs that we work in. Also, we saw an increase in Medicaid funds, which we know have been vital to some of the populations we serve to make sure that everyone has the health care they need, especially during a public health crisis. And like we said at the beginning, there's plenty of text on these slides. They will be posted at the end of our presentation. We won't go through everything, but we wanted to make sure, again, we hit the high points. The next week, again, more interesting programs and changes happening at the federal level. We also touched on unemployment insurance. We know that so many Ohioans had to file for unemployment, many for the first time over the past few months, and the state of Ohio did the very best they could keeping up with those applications. It was an all hands on deck process for the first few weeks of the pandemic. And there was also some changes at the federal level to give additional assistance for the first, again, few weeks and months of the pandemic. So some of those programs are coming to an end. We are waiting on Congress to either extend or modify those programs as the pandemic continues. Food access, this was, again, vital at the beginning of the pandemic when many were out of work or some were a little bit nervous to hit the grocery store and such. So we wanted to make sure that we provided information on where families could get food access across the state, as well as difference in changes for eligibility and SNAP and how those SNAP benefits could be used. We do have an update provided by the Ohio Association of Food Banks. Unfortunately, reign or the time that the Ohio National Guard was assigned to the food banks as well as in nursing homes to assist in testing and distributing food and personal care products is coming to an end on August 7th. We are excited to report that Governor DeWine has requested an extension of those benefits from the federal government and funding from the federal government. Hopefully we hear back soon if those additional help and those additional funds were granted. We know, again, the Ohio National Guard continues to play a vital role in the food banks and making sure that families get the food that they need, again, as safely as possible. We are also, again, one more issue pertaining to food access. The recent Senate HEALS Act does not contain a boost in the SNAP maximum household benefit. This is something that was included in the HEROES Act when it passed the US House. So we are hoping to, again, continue to advocate for an increased boost in SNAP benefits moving forward in the next few months. We know there's plenty of need and families out there are still struggling. So this would really help with food assistance and make sure that those families and children aren't going hungry during this time. Still in April, we covered a lot in April, guys. The first few weeks, we had all the big ones. In Medicaid, we talked about some of the changes and additional funding that was granted to states to help with those increased Medicaid rolls. We know that Ohio has seen, I think, close to 700,000 additional new Medicaid, or expect to see 700,000 to 1 million new Medicaid enrollees through the end of the calendar year. So we know that there is a state match associated with that. These federal dollars will help make sure that Medicaid can continue providing a great level of services to these folks who need health care and services during this time. We do have an update pertaining to legislation happening at the federal level. At the moment, the Senate HEALS Act does not include an increase to the FMAP. In the HEROES Act, we saw an increase of 14%, which is very generous and will help states greatly provide those Medicaid services and make sure we maintain the maintenance of effort. So make sure we don't change eligibility during the public health crisis. So right now, the Senate HEALS Act does not include that increase in the FMAP or the MOE. So we are making sure, again, to continue our advocacy efforts on the national level to make sure that those two provisions are included in the final COVID relief bill that we expect from Congress. And we do know, again, with the budget holes facing Medicaid, we know state revenues are projected to be in the billions of dollars short, and we expect massive cuts in state revenue. We knew this going into the pandemic. Unfortunately, the program and the services as they exist today are at risk. So we again want to make sure we continue to advocate for that increase in FMAP. Also, we wanted to make sure that the next COVID relief bill includes the Reentry Act, and this will provide Medicaid coverage to inmates in jail and in prison 30 days before their release. So again, gives those folks a better chance, making sure they get the medical care that they need to transition out of jail or prison as successfully as possible. Moving on to May, we heard from our friends at the Ohio Jobs and Family Services Directors Association, as well as the Public Children's Services Association of Ohio. We know that many county JFS workers and children's services caseworkers had to move very, very quickly to move their work from an office space to home, and making sure that they can process different applications as quickly as possible. We know that our friends at the Public Children's Services Association wanted to remind us that they are still open for business. They are have a statutory mandate to investigate any kind of reports of child mistreatment or abuse, and they are still out and in the communities, making sure that our kids are as safe as possible. And again, they're moving through things as safely as possible with masks. Check-ins may look a little bit different with families, but they're continuing to serve Ohioans and the families that need it. May 8th, we talked to, or our friends at Center of Community Solutions did a survey about nonprofit and service providers, some of the changes and challenges they were facing as we were about 2 months into the pandemic. A vast majority of those service providers did have their services disrupted. They were concerned about moving forward and operating at full capacity among their safety concerns. And it was interesting to learn that many of those service providers were really more concerned about the community and their clients than themselves during this time. So we know that there are service providers and nonprofits try to do the very, very best they can during these challenging times, and we're here to support them as much as we can. May 15th, we had a great lineup from the Children's Defense Fund of Ohio, the Kirwan Institute, as well as Primary One Health. We were very excited to have former Senator Charlita Tavares join us as well to talk about her service on the Minority Health Strike Force. We are hoping that their final recommendations to the state will be published very, very soon, and we can begin implementing those recommendations. We also wanted to make sure we are still talking about the conversation that COVID-19 is impacting communities of color differently in a more dire circumstances. So we want to make sure, again, as we move through the pandemic, we are collecting those data as disaggregated data as often as possible, so we can see how, again, COVID-19 is impacting these communities differently and that we can serve them in the most effective way. And last for me, on May 22nd, we spoke to our friends at the Ohio Federation of Teachers and the American Association of University Professors, or AAUP, talking about the challenges that our kids, both K through 12 and higher education, face going back to school this year. We are starting to see finalized plans from school districts about how at least the beginning of the school year is going to look like through the first 9 weeks. We know a lot of our big kind of Cleveland, Columbus, big city schools have decided to go mostly or fully online for the first 9 weeks, again, following recommendations from the CDC. But we want to make sure that we prioritize, again, students and teacher health and safety during this time, and want to make sure that schools have the resources they need to go back safely if they choose to do so. I'm going to go ahead and hand it over to Tara to finish out our quick recap about the topics we've covered so far.
Thanks so much, Kelsey. And as luck would have it, the trash truck is pulling up outside of my house, so apologies for background noise, but I think we're all used to that now. On May 29th, we talked with many of the experts around the state around housing and homelessness. Certainly, we know that there have been changes throughout the pandemic that have made things a little bit easier in terms of moratoriums and things for evictions, but some of that is coming to an end very soon. What we, I think, have been hearing really in the community is that we may see a lot of the eviction and mortgage issues coming to a head in the coming months if changes aren't enacted. So this is one of the things that, we're really hopeful that Congress can address at the federal level to help to avoid where we're headed. But certainly our partners around the state were able to share that, they've done a lot with the funds that have been awarded to help to address housing and homelessness during the pandemic. And it's hard to stay at home without a home. So I think it's really, it was great to hear their updates and all the work that they've been doing. Moving into June, this was a big topic. We covered behavioral health, developmental disabilities, and multi-system youth within kind of one session, hearing from, again, a lot of our partners around the state across DD and behavioral health. One of the things that we know has changed since we held the webinar is that the controlling board at the state level has approved some of the federal funds to be used for addressing the needs of behavioral health providers, helping them to purchase PPE, and helping to equip their ability to conduct more of their services online. So that's a good development, something that had changed since the webinar. Moving into kind of the other things that were covered there were, again, kind of waivers that had been approved to allow the ability to provide services in a different way in the midst of the pandemic. But certainly we know that this is another space that gaps in the system were very much exposed by COVID-19. And we are, continuing to work with these partners to make sure that those gaps are elevated and made sure that we can address them as we move forward. We next talked about older adults, kind of focused around adult protective services and home and community-based services. We all have heard many of the tragic circumstances occurring in nursing homes and assisted living facilities across the nation, but we kind of wanted to get a better sense from our partners what was happening in the community as it relates to older adults. So, I think this is another place, again, where the PPE, especially early on, was a challenge because not all of these service providers had access to the equipment that they needed to safely provide services in homes. Moving forward, we must work to protect skilled Medicaid providers and their rates. We also need to make sure that the service provision in the community is a part of the discussion always. And it's really important, and Ohio has made strides in keeping people at home, keeping people in the least restrictive setting and comfortable and safe in their homes. So making sure that we're able to continue to facilitate that is really important. The issue of childcare is one that we have heard a lot about. I know that this is one of those pieces that's almost constantly evolving. Up until this week, it was evolving. So, you know, childcare was in a little bit different setting, that they were providing care through the entire pandemic in some ways to provide care for the children of essential workers. And I think they learned a lot from that experience. Certainly, much of that was shared during our webinar. And we do know that at the federal level, the amount of support that really is needed to sustain the childcare industry now and to the end of the pandemic is a pretty, it's vital that federal support come through for that because they've had to make a lot of changes. I think it sort of remains to be seen what will happen with the change to the ratios that Governor DeWine announced just this week. But we're still kind of learning through all of this. And you know, frankly, a lot of this hinges on how things happen at the federal level in the next few weeks to see where that support comes through. Moving into July, we took a few weeks off around the 4th of July holiday, but into July, we talked about the 2020 census. This is another place where, you know, I think the news is happening fast as it relates to making sure that we get a complete count. It's really vital to ensure that we continue to have access to all of the health and human services and the safety net that we covered in lots of our other webinar topics. So this is, you know, certainly something that had to be adapted in light of the pandemic. There is a lot of changes that had to happen in terms of pushing back the door-to-door census work that's happening, making sure those people have enough of the equipment that they need to stay safe and keep others safe and healthy. So, you know, even just within the last week, there has been more discussion around whether or not the citizenship question, you know, I think there's some talk at the federal level around including that or not. There's also a challenge, again, this is a kind of a new one around, you know, deadlines, and Congress is talking about giving the Census Bureau more money, but keeping them on their end of year deadline, which is, you know, money is not necessarily the solution to this because we really have to wait until it's safe to conduct a thorough census count. And then concluding last week with a discussion with the community health centers, I think it was really great to hear all of the work that they have continued to do to provide the services that they've always provided, some through telehealth, more through telehealth now, and that has been you know, helpful to them to be able to continue to provide services that way. But then also all the work they've done to really step up in terms of community testing, setting up and operating pop-up testing sites around the state, making sure that PPE is distributed and cleaning supplies. I can personally attest to having gotten a COVID test earlier this week that was run by Primary One, and they provided bags with hand sanitizer and masks and cleaning solutions. So they really are providing such a valuable service to the community, and it was great to hear from them as well. Their sort of needs in terms of advocacy asks certainly overlap with those in the Medicaid space. That FMAP increase is really vital for community health centers as well. So with that, here's a little bit more overview of what's happening at the federal level. This is just a very quick comparison, and I'm not going to read all the way through this because I'm sure many of you have read articles on the developments in Congress, but really just compares what has come out of the Senate earlier this week. The Senate majority presented their HEALS Act, and there have been a lot of good articles. We've linked to one, but they're abundant, kind of comparing what's in the HEALS Act versus the HEROES Act, which the House passed back in May. So certainly negotiations between the House and Senate are ongoing. The White House is also part of those conversations, and I tried to check as soon as, as close to this webinar as I could to see where things stood. It sounds like there may be some requirement for a stopgap, sort of shorter term, smaller piece of legislation to help avoid a cliff as it relates to enhanced unemployment, but that a larger conversation is still ongoing. So with that, I am going to turn it over to our guest. I know that Representative Boyd was joining us a few minutes later, and I just got a text about some IT issues, never fails. But I'm going to quickly introduce State Senator Stephanie Kunze, from right down the street from me. I'm in Columbus, and Kelsey is too. So thank you so much, Senator, for joining us today. And I will turn it over to you to provide some introductory remarks. And then I think we'll kind of just take questions from folks in the chat throughout.
Great, Tara, thank you so much. Thank you for that awesome overview. It's funny, I was looking back through my notes from basically March through today, and every single thing that you covered has been something that our office has worked on, or we've heard from constituents in regards to. And listening to you guys do the presentation, really, it kind of shows how much we've been dealing with and how far we've come and how much further we have to go. Sorry, my screen just blanked, so I want to make sure that I'm still here.
You can still see and hear you.
Okay. I was like, I don't know what just happened to it. All of the Zoom went away, so I just double checked. That's never happened during a Zoom before. But anyway, so again, I think every single Ohioan has experienced some sort of, it's just been an impact in one way or another. Some, obviously, as you pointed out, in more, it's been more impactful in communities of color. Some of the racial disparities and other disparities have really been highlighted during COVID-19. One of the things that we've been saying, and I really believe is true, is that COVID-19 has really shined a light in all aspects of our society, whether it's healthcare, education, early childhood. I chair higher ed. It's definitely showing weaknesses in any place that in our society that was not sustainable or structurally built on a solid foundation. We see that a lot with early childhood. All of those things COVID has really brought to light, where we have been propping things up and maybe not fully funding and fully investing in the things that really matter. It's also shined a light on all of the ways that we're so interconnected. I think that a lot of the calls that my office receives are not just about unemployment cases and getting assistance with access to that, but also everything like you noted, from help with making sure they're not evicted from their home, making sure they have access to food, making sure they have access to healthcare. All of those things are so interconnected. It's not just the economy, it's not just healthcare. And I think the other really interesting thing that I've been so grateful for are the real partnerships that have emerged. They were always there, but I think it has been strengthened between both the business community, the nonprofit sector, the faith-based sector, and then government, obviously, and then community as a whole. I think people have really come together, neighbors have come together to support each other. And so while the COVID crisis obviously presents both a real danger, it also provides a real opportunity, I think, for us moving forward. And so I have a practice that I've been doing for several years now, and I write daily in a gratitude journal. And when COVID first started, it was odd to be trying to think of things to be grateful for through the crisis. But I think by really focusing on the good that's coming out of this opportunity has kind of shifted our focus. One of the things, again, I think just the partnerships across our sectors, and also the partnerships between, you mentioned a lot in your presentation, the federal government, the state government, and our local partners, and how really we need to work together. The state's really kind of the middleman of all of those federal dollars that we're hoping to get. We've done some disbursement of the CARES Act money. We've been really working and focused on lobbying our federal partners to give us some additional flexibility for those dollars. That's why some of the state dollars have not been released yet. We really want to make sure that our local governments that need to get access to PPE, whatever, fill in the blank, there's so many needs, that they can use those funds in the way that they see fit and what's necessary for them. Whether they're a school board or a local government. You know, we know across Ohio, just if you're in Cleveland, your needs are going to be different than if you live in Gallipolis, or if you're in Toledo or Columbus, Cincinnati. We just have a wide range of different aspects and different needs that are going to need to be met with those federal funds. So I think some of the other things that my office has been working on, you touched on Medicaid. I chair the Infant Mortality Commission. Another good thing I'm hearing is that through the telehealth option, we're actually seeing increased visits and interaction with our families who are involved in the home visiting programs and have access to Medicaid for prenatal visits. And hopefully that's going to, even though we're not able to do some of the group setting activities and enrichment classes that we were normally doing pre-COVID, that work is ongoing. And I think that's a great example. I think we're seeing that across lots of different sectors. We're seeing people really get innovative with how they reach people, how they connect, how they provide the services in a different way. I've been on a business Zoom almost every morning, every Saturday morning for about 3 months. And one of the things that the businesses in that group were talking about were just the push in technology and how COVID is actually in certain sectors, and one of them being telehealth, has really pushed it forward almost 10 years into the future that would have normally taken to get that up and running and have access to really being able to utilize telehealth as a tool to provide better health outcomes across the board. And so I think we're going to really see in the coming days ahead just all of the places where, you know, COVID has been a definite strain. It's been a hardship. It's been heartbreaking. I think that's the word I've used the most with calls from my constituents, whether it's parents who are concerned about their children. You touched on the mental health and behavioral health aspects. You know, we know Ohioans, when we were shut in, there were different issues. Now that we're partially responsibly reopened, there are different issues. And so I think, you know, between just what the impact is having on families, you mentioned the elderly population. We know that that's been a huge, huge strain. Then you've got, you know, K-12 education, teachers, staff, administrators trying to work with school boards and health departments to figure out what the best course of action is. The early childhood, that portion that you mentioned, you know, we're concerned about losing 45% of our capacity in the state, which we already know is not, we don't have enough capacity as it is, so we certainly can't stand to lose more. Higher ed, institutions of higher ed are really trying to work through how do we keep kids safe, healthy, but still provide a quality education, what they're paying for when they go to our institutions of higher ed. So then that circles back kind of into the workforce. I serve on the governor's workforce transformation board, and, you know, really looking at how do we connect people to the jobs that are available? How do we help them get additional certification, qualified for jobs if they need it while they're unemployed? How do we really kind of tie all these pieces together and connect people to the resources that they need, and break down barriers and silos when they need to have access to other services? So I kind of feel like I've talked a lot, so I'm going to stop talking. I see Rep. Boyd is on, and I definitely want to have time to hear from her. She and I both serve on the Children's Trust Fund Board, and I would be, neglecting to say that one of the other issues that we're looking at are also things, people that are falling through the cracks. We know children don't have that extra set of eyes on them from when they're normally in school or in a summer program. Thankfully, some of the summer programs have found ways to kind of socially distance and engage with families and children still. But, that's a huge concern for us. We've increased additional funding just Monday, I guess today's Friday, Monday, through Controlling Board for Domestic Violence. That's another thing that Rep. Boyd and I both share and work on a lot. But we know that the stay-at-home orders, while protecting from COVID, do present additional challenges and concerns for our fellow citizens. And so we're really trying to innovate and break down, like I said, barriers to getting people the help they need while we're still trying to stay safe and stay apart. So I'm really grateful for the work that you've been doing on these webinars. You've really covered truly the host of things that our office has been trying to facilitate with, whether it's through connecting people to federal resources, distributing federal resources, or supplementing at the state level, and really trying to bolster our community partners.
Thank you so much, Senator Kunze. I will then introduce Representative Janine Boyd. Thank you so much, Representative, for joining us today. And I hope that, I'm sorry for any technical difficulties in getting on, but happy to hear sort of any introductory overview remarks that you want to share with us. And then we're starting to get a few questions into the chat. And then I know we also just wanted to kind of talk about the issue of virtual advocacy at some point before we conclude today. Thanks so much.
Hey, thank you. Sorry for my delay. I am a new mom and, enough said, props. So thank you for having me and being patient. And then, yeah, technology, it's probably a Mercury retrograde of some kind out there because it's pandemic too. And we have another new speaker in the house. So who knows? But thank you guys really for having me. And thank you, Senator Kunze. I always enjoy talking to folks with, side by side with you. Yeah, so I did catch the mid to end of the HEALS Act versus HEROES Act, and I appreciate that comparison. I think it's really important. If you're going to talk advocacy, starting with Senator Portman and Senator Brown, really pushing for them to meet, the Senate to meet the HEROES Act closer to halfway than they have in the HEALS Act, I think is the first step, at least at the federal level. It certainly is more of a skeleton structure versus the HEROES Act. So, and we are in need. There's definitely a need. And it will likely continue. So certainly most of you are probably following what's been going on in the Ohio House. It is very unpredictable at this time. We really, our speaker situation, the way it has unfolded has caused us to be so the pandemic was already adding uncertainties, just like in everyone else's lives and work. The Ohio House is no different. And so now there's more, so there's been uncertainty around the whole criminal investigation. And now we have a new speaker who really, for all intents and purposes, learned he was going to be speaker in the last 24 hours, just as we did, and or 24 or more hours. So we don't know his agenda yet, and we need to get to go together with him. Rep. Cupp has been around a long time. He actually served with my mom previously, and just three speakers ago served with him. He selected me to serve with him on the Speakers Task Force on Poverty and Education. And we did good work together, and we were able to create a document of recommendations based on many hours of input from stakeholders, from the Health Policy Institute of Ohio to many of our school districts, superintendents, state school board. So it was very helpful to participate on that with him, and so I do know at least that he has an interest in and certainly the work he's been doing with my colleague on my side, Rep. Patterson, on creating equitable school funding, because we know that our public schools are in our communities, right? And in fact, during the pandemic, they've been the heart of our communities. They have distributed food to thousands and thousands and thousands of families, and including the families that don't have kids in their schools, so we need to protect them, because if the schools and communities go, if we abandon them, then we abandon the community, because communities were built around schools generations ago for a reason. So we cannot abandon our public schools. And so that I think that he has heard those sorts of, that sort of detailed testimony, so to speak, and has some understanding of that. And then I would tell you, in my district, probably like most districts across the state, what I'm hearing are, needs unemployment, certainly small business. My district is House District 9. That's all of Cleveland Heights, all of Shaker Heights, University Heights. And I share small parts of wards 2 and 4 of Cleveland with my sister in the struggle, Rep. Stephanie House, who's also president of the Ohio Legislative Black Caucus. And so I hear about unemployment and small business needs, a lot of micro businesses, so that's a definition that we passed in the House, actually when Kunze was in the House with me before she went to the Senate. So micro businesses are smaller, right, 10 or fewer employees, and we have a lot of those in my district. And so just having those conversations and working. So my office, I have been on pretty frequent calls with the governor and the governor's staff on support for those folks, those small business owners, and certainly with JFS, especially the director and deputy director, pretty frequently on resolving unemployment claims. And the other thing that I hear, pretty upon occasion, but it's more of a, and just please do this, is continue to do this, is protecting the safety net programs like Medicaid and SNAP. And when you talk about seniors, this is certainly something we have to consider, right? If we make it harder for people to be eligible for Medicaid and SNAP, we think, well, so a lot of my colleagues will think, well, we're excluding seniors. No, you're not. No, you're not. Because caregivers care for seniors, so if I'm an adult and I qualify for Medicaid and I have to decrease my work hours to care for my aging parent or aunt or uncle, or sibling or whomever, then I don't qualify, you are putting me in a position of I can't even care for myself now, right? And this is a pandemic. So certainly it's important to protect those safety net programs, and it's important to continue to appeal to the governor and to now our new speaker, Representative Cupp, and the Senate President, and really have those conversations and then I say this to my colleagues often, and that is that we as legislators have the responsibility of not legislating in a vacuum, because everything we legislate either integrates or collides in people's lives. That's where it integrates or collides in people's lives. Not on paper, not in the House on the floor or in the Senate on the floor, but it either integrates or collides in people's lives. So we need to be open and communicative about our policy proposals, and we need to consider how it may land, and not think of just the individual person, not think of the person who might be struggling with poverty or struggling with being underemployed, but all the other people that will affect, their children, their aging parent or ill loved one, etc. If you're talking about bills in the House that I would encourage people to, advocate on, and then certainly in a pandemic, what does advocacy look like? I'm happy to talk about that. Declaring racism as a public health crisis, which is House Resolution 31 in the Senate. My senator, Senator Sandra Williams, is carrying that resolution, and the Senate has at least offered hearings for that legislation. In the House, it has not been referred to a committee or assigned opportunity for the democratic process, which is the committee process and hearings, and hearing from constituents who've experienced racism and why it's a public health crisis. And let me explain why that's important. Legislation. Because if you can say it, that it's real, even if it doesn't affect you, but if you can say it, that it's real and it's happening and it's chronic and it's as infectious, insidious, painful, devastating, and dangerous as a physical disease like COVID, then you begin to create an environment, an atmosphere where people have to talk about it, and they have to talk about what lends itself to it. What kinds of policies lend themselves to racism being a public health crisis? What sort of things that can be reconciled, corrected, or restored through policy? What can we do in those ways to treat this particular disease? It is the opportunity to finally have real conversations around criminal justice reform policies, which are layered and complicated. School funding, equitable school funding, healthcare, not just access, but how people are treated. Black and brown people are treated in healthcare systems. I am co-founder and co-chair of Ohio's first Black Maternal Health Caucus, because maternal health is bad enough. The numbers are bad in the United States, worse in Ohio than many other states. While other countries are improving their maternal health numbers, ours are not improving. Black maternal health numbers are triple abysmal, in the abysmal category. They are very alarming, the morbidity and the mortality rates. So, and then when we look at COVID, we know there's been a study after study about the disproportionate impact of COVID-19 on Black Americans and Ohioans specifically. We were talking about Ohio versus everyone else. And it's because of pre-existing conditions. And what led to those conditions? Disproportionate funding for public schools or school funding, not having consistent access to quality healthcare, always having to fight to stay on Medicaid, or just the way people are treated in the healthcare systems as they exist. So there's a lot of criminal justice, the way Black and brown people are treated versus in the criminal justice system versus other people. So all these things lend themselves to a public health crisis that is racism. The other thing I'll just say is I have two bills that I have offered. One that I've offered every General Assembly since I've been in the House, and that is paid family and medical leave. Right now it's House Bill 91. And the other is my emergency paid family leave. I offered an emergency paid family leave bill, House Bill 593. I offered it in sort of a executive order form to the governor and his people at the beginning of the pandemic. And then have since introduced it in the House. And House Bill 593, which is the emergency language to serve during the pandemic, has not had any hearings. And I am ranking minority member on the Health Committee in the House. So it would probably come to my committee, but it has not received any hearings. And then House Bill 91, which is the traditional bill, it's a good bill. I'm happy to answer questions about it. I don't want to take too much time. But in a nutshell, it would cost employers little to nothing. They would assess premiums from the employee. The Ohio Department of Job and Family Services would set up the insurance program and create a sliding scale for the premiums based on income. and they would have a year to kind of do an actuarial study to determine that sliding scale. It's a good bill, and it's, you know, other states have done it, and they have benefited significantly from it. And I just think about the people that have had to, you know, have not had incomes during the pandemic because they could not work. If they had paid family and medical leave, or if we had at least done the emergency leave, it would have filled so many gaps, especially when we know our unemployment claims process was already antiquated, and then you hit it with thousands and thousands and thousands of more people, and it went nuts. And so people are still waiting for claims to be resolved. So I say all that to say that there are things that we should have been doing that we didn't do, things that we can do right now that we're not doing, and we are hoping that the dawn of a new day in the House, another new day. I'm trying to be cool, be professional. Another new day in the House, that we will be able to move forward and do some of these things that should have been done and that we could be doing. So I'm open to questions. I hope that answers some.
Thank you so much, Representative Boyd. That actually, you know, I think what you and what Senator Kunze covered leads perfectly into kind of the other main question I think we had of you joining us today, was just what, you know, maybe we aren't to the point yet where we know what works well, but I'm curious what your take is on how to engage in advocacy virtually. I know that, you know, in some spaces in the State House, especially over on the Senate side, there is a little bit more room to be socially distant. The House hearing rooms don't necessarily lend themselves to social distancing, but, you know, I think by and large, we're going to be doing things like this, like seeing from here up on people for the next several months. And so I'm curious kind of what your experience has been with virtual advocacy so far, if you have thoughts about, you know, how you're planning to engage, or the best ways to engage you going forward, especially in the next few months.
You want to go, Kunze?
It doesn't matter. I was going to say, you can, either way, you know, I think that obviously I've been spending a lot of time on Zoom, like everyone has, conference calls, been doing a lot of those. I've been on just one-to-one calls. I've never had so many texts, emails from constituents. Obviously, you know, I think any manner that is available, that is, you know, I've met people for coffee at a, you know, somewhere where we can stay 6 feet apart. I've had people I have a conference room next door to my office. So some people have actually wanted to come to the State House. I've always given them an option not to if they don't want to, but a couple people have wanted to come, and we can meet really easily in the conference room there. It's really big for 2 people or 3. It's pretty easy to stay. So I think really, you know, all of the traditional ways that through email and technology that we have been, my office is still open, staffed. My staff is working hard to take constituent calls and connect them to usually the administration, as Rep. Boyd pointed out, the usually ODJFS and Medicaid and Health are the 3, obviously, they're working the most with. But I don't really know, Rep. Boyd, if you have any other more creative ways. We have a newsletter. We still are doing social media, newsletters, all of that stuff on the official side.
Yeah, I don't have any creative.
I would say,
yeah, go ahead.
I'll offer a couple of tips. One of the things I think people don't realize is that as a state rep or as a state senator, a lot of times I will connect my constituents with their federal representative or senator, depending on, you know, what the need is. And then that's a real service for them, I think, that they don't realize that they can have access to. And then the same with local, if they have a question that's actually more of a local, with home rule being, that's been one of the biggest things we've been feeling, especially in Franklin County, because of our different layers of government and who's actually the decision maker on some of these issues. That's been a lot of confusion. And so I've been really trying to explain that, you know, when you're advocating for something, I'm happy to connect you with the person that's actually going to be the person making the decision if it's not going to be me. The other thing I would recommend is Rep. Boyd very nicely put some of the angst that's been happening in the Ohio House. So the Senate has been really trying to continue our work and be a steady voice and a steady body while that's been happening. But I would also encourage people when they're doing their advocacy, don't forget, you know, reach out to your senator, but reach out to your rep, or reach out to your rep and your senator, because, you know, the legislative process is slow, and it was meant to be for a reason. We don't want it to be slow on certain things. But during, obviously, the pandemic and the summer recess and all of the things, the Senate's still been meeting. But the House, obviously, I don't think has met, since June 11th before yesterday, or June 12th. And so there's still a lot of things that, you know, you can call me and ask me to do them, but I can't do them without my partners in the House, and then obviously at the governor's office. So I'm happy to connect people to all of the branches at the state, as well as our federal and our local partners.
So, and I'll just add that while the leadership in the Ohio House has not provided opportunity for us to convene as a body to legislate, your legislators, at least this one, has still continued to conduct town halls and had one earlier this week on paid family leave. I have two next Thursday, and one on education and reopening and all the anxiety that surrounds reopening our schools and the different sorts of models of reopening, and what does that mean, and in terms of, you know, everything from testing to the report card. What does that mean in a pandemic? All those things. What are people in ODE and the administration thinking, and how are they going to work with our school districts? All those things are still very much at the forefront of those of us who have not been able to convene in the body to pass policy. We are doing that work. I'm doing that work, and certainly very accessible still to my constituents. And I would also say that, you know, if you can follow your legislator and see if they're doing sort of virtual town halls or meetings that you can participate in, that's a great way to find out what's happening. Certainly I have a newsletter as well. And many of us do. But these are very helpful. I mean, it's helpful to hear from other, you know, stakeholders who are involved in advocacy. If you don't follow, you know, a Children's Defense Fund or Center for Community Solutions, start following them, because they offer these sorts of community opportunities, you know, and you know, previously it was in person, but you see they're still doing it, and you can hear from different legislators and probably congressional members that will host if they haven't already, and local governments as well, county and otherwise. So it's important to get involved with your local organizations and follow your school district. And because that's so, like for my town hall, my superintendents of all my superintendents in my district will participate in my town hall. So my whole district will be represented. So following your school districts and I have a number of private schools in my district as well. If they're going to have any sort of town hall conversation about reopening, it's important to just follow them online, get their emails if you have access. And call your legislator. You can call me, 614-644-5079. That's 614-644-5079. And we can tell you if there's going to be any events that are legislative related that you can participate in and hear information about. My LA is amazing. His name is Ethan Goodman, and he works tirelessly for me, especially and for the district especially, but when I'm chasing the baby and I have to not be able to be on the phone, he can get on the phone for me. So we're partnership, and it's very helpful.
I see Senator Kunze added her contact information in the chat. Thank you. I will share that. And then just relatedly, because we're on this topic, someone chimed in and just mentioned, one of the challenging things about not being physically in the State House is those sort of like hallway conversations, personal relationship aspect of that. And so, texts don't totally take the place of that, but any thoughts there?
Well, I would just say, let's keep it real. So there are people that you can build relationships with in any environment, and there are people that you can't. So I don't think a hallway or a coffee or a lunch or anything like that is the, not being able to do that is not the barrier. You understand what I'm saying? You can build a relationship with people online. People get married after they meet people online. You can build relationships with people virtually. You don't need a hallway, but there, you just have to you have to be real with yourself. There are going to be some people that you just can't build relationships with, period, no matter what the environment. So I'm just going to leave it at that. You got something to say, Kunze?
Interestingly, one of the fun things that I don't know if that's the right word. One of the things I did to kind of challenge myself during COVID was I took the Yale happiness course online. I highly recommend it. It's very well done. And I had a group of people from across the country who we almost did like a book club, made the class like a book club. And we were on a Zoom. There were about 15 of us, all different walks of life, from millionaires, NFL players, to people who work an hourly job, all different races, backgrounds, whether, some were married, some were 20, some were 60 years old. It was just and so I guess kind of building off of when Rep. Boyd was saying that, I thought, yeah, I met and built a relationship during COVID with people all across the country who I would have never had an opportunity to meet, just because I got invited to do this Yale class anyway. So I think I'm just in agreement with Rep. Boyd. And I think, as she pointed out so aptly, our constituent services are still ongoing in our offices, and our aides are wonderful. Rep. Boyd does have a great aide, and they're always willing to set up calls or connect any of you and our constituents with us anytime. So I do miss seeing people's faces though in the halls, but it's been great when we've been in the Senate, even just the one day or so that we're trying to fit everything in. It's been one of the biggest blessings is just to see the people that we've built relationships with over the years. And I think that's an advantage for both Rep. Boyd and myself, that we have worked together. We've worked with people in the Senate, the House, worked with different groups and organizations, and really have built those relationships over time. One of the things I said when I left the House, I read the book, The One Thing, and I decided when I got to the House, it was so overwhelming to know all of the people and know all of the organizations and just all of it, that I picked one thing instead of picking one policy area or all the different ways that you can kind of narrow this job down. My one thing was build relationships. And so it's actually served me the best over the years. I've now kind of spread it into every area of my life, not just work, because really it's the key to really understanding all of the rest of this things that we need to know about with this job. So of service to our fellow Ohioans that we love and care about and want to help in any way we can. So.
All right, and thank you so much for that. We have time for maybe one more question, and this kind of, I would say, maybe as an umbrella over the connectivity issues and virtual lobbying and virtual advocacy that we've been discussing. So one of the issues that really has emerged over these past few weeks is broadband access. And we have kind of two sides of that coin, both accessibility and affordability. I know both Representative Boyd and Senator Kunze represent more of a suburban kind of area, so maybe accessibility may not be an issue, but we know affordability and of course having access to technology, the laptops, the tablets to really take advantage of that connectivity can be a challenge to some families. And especially we know just our interconnectivity when we talk about telehealth, we have distance learning, the ability to search for a job online or apply for benefits when they need it, as well as trying to combat social isolation for our seniors. We know that broadband access is just so vital, especially with all the services and all the issues we've really talked about so far. Wondering if you've heard any kind of maybe programs, or we know that there's a couple bills in the House, I think just passed to the Senate, House Bill 13, talking about increasing broadband access, or if you've heard of any creative ways school districts or any other kind of organizations within your communities are working to help extend broadband access to those who need it during this time. Either.
Well, I know Rep Boyd, you're right. What is it called? House Bill 13 just was assigned to a Senate committee, and we're hoping to have hearings. And really, I know the Senate's committed to looking at Rep Carfagna's bill. He's worked that bill very, very hard and has met with senators already on it. So that's been a great thing. I know that school districts across the state, some have used busing, have used their buses as hotspots to try to bring access. Obviously, anywhere in our community that we've been able to, through libraries, it's not ideal. We don't want kids to have to drive to a McDonald's parking lot or to a library to have access to the internet. And one of the interesting things I heard on one of the calls that I've been on over the last months is it's not just the kids either. And obviously that's a huge part, but it's the teachers. Some of the teachers live in these areas and they don't have access to a connection. So it's something that I don't know if Rep Boyd has other additional examples of, but it's something I know we're committed to. It's an infrastructure that we need to have in this day and age it's another thing that COVID has shed light on in a place of disparity. And it's something that needs to be fixed for sure.
Yes, so those bills, yes. And I serve Lieutenant Governor Husted invited me to serve on his Innovate Ohio advisory board. So I am an advisor on that board. And I just pulled up my text with him earlier on in COVID, when COVID hit, and we started to, when we acknowledged COVID hit, and we started to respond appropriately, that, there's a list of telecommunication cable companies that, did provide hotspots, had committed to providing additional hotspots, even to folks who weren't actual customers across the state. I have not checked in since then to see how that's going and how long that commitment will last, so I will do that. But I know my school districts, for instance, in my district purchased more hotspots, but that was before they got cut 20%. And now they're preparing for, we are all preparing for potential future cuts, given the direction our numbers are going for COVID. It's very possible. So that I know of, and I'm happy if there are ideas from this webinar that people would like to submit to me that I can bring to the advisory board. I'd be more than happy to do that. This technology is not my area of expertise. But I listen. I'm a good listener, so I would be happy to take ideas to the advisory board and really figure out how we can do that. And then also that goes back to what Tara was talking about with the HEALS Act versus the HEROES Act. And I'm gonna go back to school districts, because once again, and I don't mean to harp, but I'm saying these schools have been in the heart of our communities distributing food and masks. So chances are, if you are near a school, if they have enough hotspots, you can you know, as an adult or a child, you can benefit from that, right? So if there's a way for us to consider making school districts or schools in our communities rather, across the state, you know, the high school in each community, the epicenter of acquiring access to technology, that could be another, because they're everywhere, right? Whereas hospitals aren't, right? So at least we know schools are everywhere, and if there's a way, maybe we can make them the epicenter. Maybe Kunze and I should do a bill, so we can talk about that. I'm serious. So, and I can talk to the Lieutenant Governor about that too. It's just came to me. But if there are ideas people have on how to expand technology for everyone during this, you know, because we're gonna have to grow from this. It ain't gonna go away, right? I mean, it's the new day. It's a new time for us. So we do need to get more connected technologically, and we need to access expanded to do that. So if there are any additional ideas, I'm happy to submit them and have conversations about them.
Well, thank you so much for your time today, your responses to questions. We had a lot more coming through the chat that we ran out of time on. So if it's okay, we'll send those to you in an email afterward and get some feedback and share those with the webinar attendees today in the sort of follow-up email. That would be great. Thank you. We just very quickly wanted to give a quick notice of we will be off next week in terms of webinars on Fridays, but Community Solutions is hosting a webinar on August 14th on women and how they've been impacted by COVID. So we know so far that we'll have State Senator Antonio and a speaker from the Women's Fund of Central Ohio. I think a few more to be determined, but please join us on August 14th, same time, same day. And we are kind of in our Advocates for Ohio's Future Community Solutions webinar series, gonna come back in September to delve into kind of more budget focused issues. So looking at things from kind of the local, state, and federal perspectives as we venture into the lame duck period and the next biennial budget. Obviously there's an election in there too, so I'm sure that will impact things. And we just wanted to thank you all so much for joining us today. And for those of you who've joined throughout, thank you so much for your time. I know we went a little bit over today. Thank you to Representative Boyd and Senator Kunze for your thoughtful responses and statements today. I think this is a great way to hear directly from you and connect directly with you. So thank you so much for your time today. Kelsey, any other closing remarks?
No, thank you again for your time. This has been fantastic. And thank you for your work in connecting your constituents to the services that we need at this time. I mean, I know we all got into this work to help folks who need it. And we're thankful for your commitment to your districts and your service in the State House. And we look forward to working with you in the future. All right, and thank you again. We will see you all next time. Please enjoy the rest of your day and have a great Friday.
Everybody stay well, stay safe.
Thanks, Representative.
Thank you.
Bye, Senator.